everybody. I'm Lynette Moore. I'm the Director of Quorum at the Science Center, and happy tonight to be hosting this conversation talking about mask redesign. I think we're all very familiar with mask wearing the last 8 months, and for me, I have a big pile of them sitting next to me. They've become my new accessory. It's not about scarves or necklaces or fun jewelry. It's what kind of fun mask do I want to wear today with my outfit? So but I know that some masks are better designed for helping with keeping the germs contained with COVID. I know that some masks are great for being outside, some inside, and all of that. So tonight we'll talk a little bit about kind of the science behind it, but also kind of the fashion behind it too. And then at the end of the session, we'll do a little bit of brainstorming of kind of what we like about the masks, and then what we kind of want to do for fun stuff or ideas of innovative ways to enhance the masks, because we'll probably be wearing those for the next few months or so. So they're not going away anytime soon. But first, I'd like to kick it off and talk to each of our speakers tonight. So I'm going to let them introduce themselves and talk about who they are and their organization. So Elissa Bloom, I'll let you start with an introduction.
Great, thanks, Lynette. Hi, everyone. My name is Elissa Bloom. I am the Executive Director of the Philadelphia Fashion Incubator at Macy's Center City. We are a nonprofit that supports emerging designers here in Philadelphia, helping them build, scale, and grow their companies. We are in our 9th year, and we have graduated over 42 designers, and it's been very exciting that we've had a really great success rate. We have over 70% of our alumni are still in business. This year we have an incredible group of 5 female entrepreneurs that are in our program. And I'm really excited about this conversation because right when COVID hit in mid-March, I was contacted by the Commerce Department to compile a list of designers and volunteers and manufacturers in the community to make masks because they realized that there was a shortage. And within 24 hours of my outreach, I got connected to some other industry leaders in the city, and we decided to form a task force called Cover 8 PHL. And it was an incredible initiative where we were not only, I was spearheading the volunteer efforts with our designers that were volunteer making masks, but we were also manufacturing masks. But with the DIY effort, we, in 6 weeks, were able to make over 7,000 masks and deliver them to 19 healthcare facilities in the region. And it was an incredible experience of just this community coming together and really just incredible work that everybody did banding together with this initiative. But as Lynette, you mentioned, I mean, it's so much of mask design is not only about the functionality, but there is that fashion aspect too. So I'm excited to delve into that more this evening.
Great, thank you. Next, Kumiko Lippold, why don't you introduce yourself?
All right, yeah, thank you. Hi, everybody. I am thrilled to be here. My name is Kamiko Lippert. I am a project officer / scientist in the BARDA Division of Research, Innovation, and Ventures. I'm so excited to be here because we have some very interesting things coming down the pipeline that I think you guys would be very interested in. And you know, when it comes to masks, it's something that we all understand is very important, and we like to think about things and how do we make things safer for the American public, and how do we create products that people feel comfortable and safer wearing. So, you know, that's a big part of why I'm here. It's because I've been working with my amazing subject matter experts and geniuses in BARDA Drive. You know, a few of them are here, Pejman and Adrian. I'll go and give you a shout out because, you know, they are the ones who help us understand what are the needs of masks and, you know, what are the opportunities and how can BARDA, and more specifically Drive, leverage our our capabilities in the early stage innovations to move the needle. So I'm just so excited to be here and hear about everybody's ideas. So thanks.
Yeah, thank you. And last, Fang Wen, please introduce yourself and tell us a little bit about your organization. Oh, you're on mute.
Be unmute.
Yeah.
So sorry about that. My name is Fang Wen, and I'm a fellow at the Center for Biotechnology in New York. We are a New York State a center for advanced technology with a focus in biotech, life sciences, and healthcare. We have been around for almost 3 decades in New York, really with the missions of developing and advancing innovations and building an infrastructure and ecosystem in New York to support innovations that really come together to address all of this sort of healthcare and medical challenges that we are facing. And we with the Science Center have been working with Border Drive as the one of their 13 accelerators across the nations to really amplify the innovations that specifically suitable and important for protecting the US public. I guess I'm here for that kind of a dual purposes, because New York was probably the first epicenter of the pandemic, and with what we have gone through as sort of the state together to the first wave of the pandemic, we and our innovator has been very fast in responding to the pandemic through innovations from the design perspective, but also from the biotech and the life science through various diagnostic device and coming together really to bring a sort of a constellations of innovations that help the public sort of the public health challenge. So I guess I'll bring some of the experience that the New York designer have encountered and have learned through the process of banding together to provide masks since March, where there was a huge shortage from all the hospitals, and how they was able to really bring both of their expertise in design, but understanding the materials, understanding the distribution, understanding the needs and the sort of the wearability. Is it easy to wear for someone who has to wear it for an entire day, such as the New York police force? So I'm excited to be here and contribute to this conversation.
Great, thank you. This is fun. We have like all sorts of the innovative side, the entrepreneur side, the science side, and the fashion side. So I think this will be a great conversation. For attendees that have questions along the way, feel free to use the chat window and throw questions in there. Or you can unmute yourself. Towards the end, we'll have some time for questions and answers as well. But I'll kick it off. Fang, since you're unmuted right now, I'll let you start this one. So what limitations does the current design present to wearers?
I think one of the limitations that I hear over and over again is probably the breathability. Like it's very for individual who has to wear it for a long period of time. Sort of the how the trade-off, the balance between the airflow, ensuring the airflow that make people comfortable, especially for certain population that might be anxious about wearing masks, right? Like children or people with disabilities, and ensuring that, as well as keeping the safety level. And again, as I said, my colleagues have mentioned materials, how to sourcing the materials that is ensure, might not be medical level of protectiveness, but the highest protectiveness that we can source from the existing materials that is easily accessible and that can also fit into some of the different. We got get into manufacturing here. In the early days of New York Response, it was very distributed. It's not like a manufacturing facility, but really at each individual house, the individual sewer that was really there to make the mask. So I think that's the two main things that I've heard across our network.
Mm-hmm. Yeah, definitely. When this first went down, I was on Etsy, like ordering up masks from, basically crafters that were doing this at home. And then, I've accumulated them over time from like different friends, moms who sew and, had some extra material around. And that definitely helped out with kind of the supply and demand for kind of the everyday user of the mask. So Kamiko, do you want to talk a little bit more on kind of your perspective on that same question?
Sure. Everything that I'm going to say, I'm going to mirror what Phuong said as well. As we've been talking to people and as we've been trying to understand what the barriers are that really limit mask innovation and also limit the uptake and adherence to mask mandates in many states, we've noticed similar themes. First one being comfort and breathability. I myself, nobody wants to wear a mask in 98-degree weather with 100% humidity in DC. So if you want people to wear a mask and protect themselves, it has to be breathable. It has to be comfortable. And that's the issue of comfort is actually a big barrier that has emerged as we've been trying to understand what this space looks like. So the question becomes, well, how do we make a mask that's comfortable, but also balance that with safety? Because, in a way, there might be a trade-off there. And although mask innovation and sort of the frontiers of what we know as the designs of masks keep getting pushed, it is that question of, well, how do we balance safety and how do we balance comfort? And then how do we balance fit? Because, it's not just enough to have a mask that's comfortable, it has to fit well and it has to protect you. So those are some barriers that we see as we've been trying to scope out this space. And, just to that end with the science piece, there's not any standards available on what's the minimum level of protective capability that these masks should have. So that's also a question that we're navigating as we're trying to figure out, well, what does the ideal mask look like for the general public, and how protective, what's the minimum level of protective capability that these masks should have? So it's an interesting space to work in, and I don't know if there's any right or wrong answer, but trying to strike that balance between fit, comfort, and protection is a challenge. But with that said, we've seen a lot of really interesting designs that seem to get around some of those issues. Mm-hmm. So it doesn't seem like the issue of fit or the issue of comfort is too much of a limitation, because there's an incredible amount of just innovation going on in this space already. And I think with mask redesign in general, particularly with the COVID pandemic, we're seeing an incredible number of just really novel ideas that we hadn't thought of before. So the barriers are interesting. It comes down to fit, it comes down to comfort, it comes down to the science and what's the minimum level of protection that we need. And then the final thing that I want to raise is sustainability. What sort of, because we anticipate using these for a very long period of time, because COVID's not going away anytime soon, and we're all likely going to have to continue wearing masks. If we can get people to wear masks, we also have to think about, all right, well, what are some sustainable materials that people can make these masks out of? And that's especially important, in this day and age, as we're thinking about, how do we make our behaviors more sustainable? And that also extends directly to our masks. So it comes down to, for us, it comes down to science, sustainability, comfort, and fit as the big barriers and things that need to be addressed.
Yep. Elissa, I'm sure fit is probably on your list as well, being from the fashion world, and kind of that one size fits all doesn't really pertain to people very well. Do you want to talk a little bit more?
Sure. I mean, I think just to back up what Kamiko and Phuong also shared about, how important fit is, and also the functionality of the mask. When we had launched the Cover APHL and the DIY effort, the volunteer effort, we wanted to make sure that we had a mask that was not only fit well and was functional, but also had the approval from healthcare providers that we were going to be donating to. So John Van Afra, who's one of the founding task force members, created a pattern, and we still have it online. It's on coveraphl.org. It has been approved by many different healthcare facilities before we went forward and shared that with our over 200 volunteers. But I am really amazed how many masks are poorly made, how designers are not getting the fit right, how they're either too big, they're too tight, there's elastics that are like pulling too hard on the ears. I mean, I have bought, like Lynette, many, many different masks, mostly from Philadelphia designers in our community. And it's been really interesting to see just how different the designs are and how the fit is from one designer to the next. There is an incredible local designer, Nancy Volpe-Berenger, who has designed one of my favorite masks. She started a whole mask community, but she has a adjustable elastic, so you can adjust for the right size. And she also, for kids, because my son, I ordered 3, actually he just gave one. This is for Phillies, but it has an elastic, so it goes around the neck, so you can't lose it. And that's another thing that has prompted like a whole new product category, our mask holder. You know, we take our masks off, we throw them on the car seat or on a table or in our purse, and they're getting dirty, they're not sanitary at that point, sanitize. But we have a designer, alumni from our program, Minky Blue is her company name, Cheryl Mosey, who designed a line of mask holders to hold your masks. But it's just interesting to see how there's all these other accoutrement accessories that have come about from this new category. But, you know, I think the most important aspect of the mask design is making sure that the wire is at the nose and the wire at the bottom. Nancy Volpe-Berenger, I mean, most of the designers do put the wire in, but she has wire at the top, but also at the bottom. So if it's too big at the bottom, you can pinch it to close it. You know, I'm always surprised when I'm out and about doing errands, how many people are not wearing the mask correctly, how it's like under their nose, or, you know, the air, you can see they don't have it fully over their nose. So I think, you know, because there's so many different shapes of faces, you know, it's important, like how do we address that? And one of the interesting mask designs that came out from Cover APHL, it was actually through Next Fab Studios. They had designed an origami mask that I think is still selling, but there was one of their members had designed this origami mask that had a lot of great success, and I think is still selling. So, and then again, like the fashion part, Katrina will appreciate this. I think it was actually the end of March. A friend of mine in Lithuania had started a Facebook community page with fashion masks. And just as we have all been talking this evening, I'm just like so in awe and inspired by some of the incredible fashions that these designers have done with taking these masks to like a whole different new level. And just the creativity and the innovation that's taking place in the space.
Yeah, there's definitely lots of innovation and creativity going on. Someone had mentioned in the chat that they're making a clip to put on your shirt to hold your mask. So that's another thing. Someone asked if the origami mask is from Air 99.
That I'm not sure. I can put the link. I'll look on XFab and I'll put the link in.
Great. Another question that just came up when this came up as we were talking about, when you take your mask off and you put it on your car seat or on your desk, and it's like, okay, now it's not sterilized anymore. So Marvin was asking about mask sterilization. Marvin, do you want to take yourself off of mute and talk a little bit about what you've created?
Sure, thank you. I run the Makers Meetup, and a few months ago, a couple of the members got together with the idea of creating a unit for sterilizing masks that we could send out to as a DIY build to the world maker community. And we've been working on it ever since with Dale Dougherty at Make Magazine. We have about a half dozen volunteers, including 3 PhDs, some people from Penn and others. The challenge was to come up with a sterilizer that would do the job, was safe for the mask, was simple to make, required no computer programming, and could be constructed in under for probably less than $200 in a day or two's time from materials that you could basically buy from Amazon. So we had a pretty tall order, and we settled on dry heat. And at our website, you can see what we've come up with. We're still 2 weeks away from getting the website to the point where the build instructions are as clear as we'd like. But if you go to Lightbox DIY, you'll see what we've come up with. It's made of plywood. It's very simple, very easy. It abides by the CDC and Stanford and other guidelines of what it takes to deactivate the virus. We hope that a lot of people around the world are going to make it. Since beginning this, we've also been in touch with a couple of local manufacturers that are now looking at building commercial versions that would be made of sheet metal as opposed to plywood, and wouldn't use aluminum foil, and it would make some other improvements, but basically it would be the same principle. So my question to the folks here is considerations for masks that are durable enough not only to be sterilized, but that they can be cleaned. You send a mask with your child to school and it comes back maybe covered with virus, but also, and regardless, covered with schmutz. And you want something that you could put under in the laundry or even just under the tap, where you could clean it with some soap and water and not have it damage any filtering, and have it dry quickly, and yet also be able to sustain, for example, a dry heat sterilization. So anyway, that's the Lightbox story.
Great. How long does it take for it to sterilize it?
According to the CDC, if you get it up to roughly 70 degrees centigrade, you really don't need much more than 15 minutes. We're going to recommend between half an hour and an hour, just to be abundantly safe and sure about it. We're even sourcing inexpensive supplies that people will be able to get, where they'll be able to put little stickers on a paper bag that the mask could go into, which will indicate that the contents have been heated to the right temperature for the right period of time. But it doesn't take long using dry heat. There are a lot of other methods like UV, which we examined, but UV requires that all the surfaces be exposed. And of course, UV lights are much more expensive and hard to source. A wet heat will actually damage the mask. You can, expose to things like hydrogen peroxide, but it's a poison gas. And there are other solutions like that that really don't lend themselves to something that you could use in a classroom or in some other small institutional setting, your local police or fire department, for example. The box we've created is about 1 foot by 1 foot or 1.5 feet by 1.5 feet. Even in something that small, which is portable, it even has a handle on the top, although it's a little heavy being made of plywood, we can do hundreds of masks a day. And again, it costs less than $200 to build and about a day or two with no special skills or equipment.
Great, thank you.
Thank you.
Yep, part of the accessories, part of masks that we have to think about these days. So for our panelists, what are some key things that designers or entrepreneurs should consider in a redesign of a mask? I know we've kind of touched on that a little bit, but maybe we can talk a little bit more about, the things to look for when you're considering this. Elissa, do you want to take a shot at this first?
Sure. So I definitely, as we've discussed, like the fit has to be great. Making sure that the pattern is sufficient. But from a fashion standpoint, I love seeing how women, I mean, I don't know if they're out and about wearing them. I haven't seen them where I live, but I've seen like photo shoots, or we've seen like Nancy Pelosi, like the mask is the same color or fabric as the dress. So I think that that's, really wonderful to see like a whole matching ensemble, that people are really like re-looking at, how these masks are, part of an outfit, that it's an accessory of the outfit. And I think, as I said, just how many masks people are using for political statement, it's great just to see, what creative sayings are on masks. But yeah, I think, I've seen some masks. A friend of mine was wearing a mask that was all beautifully embroidered from these artisans in Guatemala. I've seen, beautiful beaded, encrusted, Swarovski crystal masks. But, I think the most important thing that we have to get back to, besides, the fashion aspect, is what we've been talking about from the beginning, is making sure that it is going to be a good fit and a good pattern, and that it is going to last more than one cleaning or one wash.
Right, yeah, exactly. Kamiko, do you want to take a shot at this?
Sure. So, it's an interesting question. As we've talked to people and talked to all the experts in the field, we've heard a lot of interesting answers about what are the most important things that people should consider. And, the first thing that I will say, and this is a tough one because some of the science is still so new, but being data informed with your material choices and thinking about the end user early on, because, as Elissa said, and as we all know, people need to want to wear their mask. They need to understand how the mask works. They need to understand how it protects others. And if possible, if there is a mask that can be designed, how can it protect them? Because I think that's a big opportunity here for designers and scientists, is how do we design a mask that, in addition to protecting others, it also protects themselves? So one of the big key things that needs to be addressed is, we have to educate people on the features of their masks. So in addition to developing a mask, we have to make it very clear how it works. So that kind of, and then also related to that is also the human factors component. You want it to be something that people want to wear. And it comes back down to thinking about the end user and thinking about the problems that preclude people from wanting to wear a mask. And we went over some of these earlier, but it's just thinking about those things ahead of time. And it's something that, we're thinking about, because it's so easy to get caught up in the solution. And the solution in our minds is, oh, well, wear a mask. But, it's not always, that's a solution to a much bigger problem. And the problem is those underlying behaviors that keep people from wanting to wear a mask. So If we think about that and then work backwards towards the mask, I think we'll come up with a much better solution.
Yeah, definitely. And, I think because we've been in this for 8 months now, and, there's fatigue, people want to go back to, pre-COVID life. And I hear a lot with people with kids and how, they want them to play sports again. So I think that's a great design right there, is, for kids playing sports, like that's something that's breathable, but also it's safe so that they can interact and have these games again that they can't do, but also being safe to others and to themselves. So
And actually, I want to jump in and say one more thing that
Yeah.
you just reminded me of. I was having an interesting conversation with somebody else, and they asked us if we had ever thought about masks for children. You know, how do you design a mask for children? What does that look like? How is that different from a mask for an adult? And I think to the point that you just made, I mean, that's something that we all need to think about, because the way that a mask fits an adult won't be the same that the way that it fits a child. They're much smaller, they have different face shapes. It's something, I mean, there are masks on the market for children, but I think that is an opportunity to sort of to strengthen and, you know, re-innovate those designs to where kids want to wear them. And that could be anything from the design part where you make something that's cute, but also thinking about, you know, well, kids are going to be kids. So how do you make something that's durable and can withstand getting dirt and, you know, Lord knows what else they get into.
Exactly.
Lynette, I also just wanted to add, as we were talking about kids, I think something that's very important that designers need to look at is a special design for the elderly. Because I think many elderly don't want to wear masks, or they're wearing it incorrectly. It's uncomfortable for them. They're not used to having something on their face. Well, none of us are really. And also the homemades, you know, people that are going in and out, working with the elderly, because I think that this has been a problem and a challenge from what I have personally experienced with a relative, and also a friend of mine that unfortunately lost her father to COVID. It ended up both of the homemades tested positive, but they weren't wearing their mask correctly for many of the times while they're in the house. So I think the education part and, you know, a redesign that is going to make wearability easier for someone who's elderly.
I also think it's a challenge for men with facial hair. I see this people with long beards and the mask just doesn't fit at all. So yeah.
Yep, that's true. Phuong, do you want to weigh in on things that we should consider for a redesign?
Yeah, certainly. I think I agree with all the point that Elissa and Kumiko talk about, and I want to especially echo when it comes to sort of like the science part of it, you know, is the materials, understanding the materials, and also, you know, it's evolved as sort of we understand more about the transmissions routes of this pandemic, right? You know, to enhance the protections, as well as, you know, designing for ensuring airflow. You know, there's some innovative ideas out there to ensure airflow, because a lot of sort of the resistance coming from, you know, the airflow, they feel difficult to breathe, and, you know, it doesn't smell good after a while. And I know that some of the company has sort of, you know, create this sticker, like the aroma sticker, to improve that. So all those things, I think it's really a blend of the science and also the design as well. You know, the how to enhance the protectiveness by choosing the right materials, working with the material science innovations, as well as, you know, adapting that to the needs of different populations. And another thing that I've heard a lot as well when it comes to innovators, that you know, not just producing one or two masks, but a large quantity is quality control. Right. When it comes to that, how do you ensure the quality control? And it also touched on the point that Marvin said about sterilizations. How do you, you know, is there a way we can sort of determine the life of the mask? You know, is there a way we can we have to think about the durability, the shelf life, and all of that exposures, and, you know, even just sort of a way of measuring the pathogens accumulation on the mask, something that probably very important, you know, when it comes to area that is, you know, have a kind of higher risk, and there's a lot more interpersonal interactions. than some one's prescribed. So I think I want to emphasize two things: is that quality control for mass production, but also we talk about customizations. We talk about for different population, for different not only age and need, but also the exposure, the context of where this the wearer are in sort of the daily life.
Mm-hmm. In the chat, I was noticing someone had made a comment about accessibility with those with like sensory issues. So for people who don't, yeah, go ahead, Elissa.
Yeah, I just wanted to mention, so Nancy Volpe Behringer and one of our alumni, Victoria Kageni, and I can put their websites in the chat. They both came up with clear vinyl masks. So I know that they've become more popular because there is such a big need. I have a friend whose son has hearing challenge, and he, I remember in April said, he needs to read lips. So I think that it's, definitely being addressed, but I'll put the two websites in the chat.
That'd be great. Okay, so next, let's talk about challenges and opportunities. Like with the mask redesign, what's some of the biggest challenges people need to consider or think? I mean, we've highlighted a few. We've talked about like the type of material, is it accessible? But is there anything else that you think people should consider as we think about like a mask redesign? Phuong, do you want to start with this?
Myself, sorry, I need to unmute myself. So I think for any innovations, and another thing as well is for the mass design, we talking to customer, understanding your what the needs are. So we talk about concept of empathy design, right? You listen to what they experience every day. I think that really is a great point to start, rather than going in, and it's really where you're going to be able to address the customizations for mass. And I admit this as a joke, but I think it's kind of true too, because around I think March, when the pandemic started, in sort of the outbreak started in New York, I was telling my friend that maybe mask will be an item in New York Fashion Week this year in October. Mm-hmm. and it was to some extent. So the fashion as well, and it really resonated with what Kumiko said. It's changing the behavior. So how can we make the mask wearing not just kind of a burden, but something fun, something that is just a fashion statement, for instance. Mm-hmm. Something like that. I think that will be really motivating, adoptions of the mask. Is mixing that. I think that would really enhance not just the public health messages, but also very individual kind of messages as well.
Mm-hmm. Kamiko, do you have anything to add?
Oh, I definitely do. As we were listening, as I was listening to this conversation, something became clear to me that, it's a challenge that we're also struggling with. And, when you have these really great innovative masks, or when you have a really neat idea, from my own science background, you always have to think, well, how are you going to measure it? How are you going to study it? So when you have something that's not a typical face mask, that fits different or functions different, it's a visor, it's something that's not what we see as an N95 or a surgical mask, how do you test it? How do you prove that it works? And that's something that I think we need to think about up front, and that we have to think about, all right, well, you have this really innovative design that we've never seen before, but how are you going to prove that it works? And is that something that's backed up in the literature already? Has somebody else done it? Are there standardized tests that you can use that are applicable across the industry? And I don't know if there's a good answer to that. And I think that's an opportunity for both design innovation and, frankly, scientific innovation, that we can push the frontiers of, how do we measure these things? How do we test them? Because we have good ways to test regular masks that fit and, seal off around your face and your nose. But how do you test an air curtain? And these are things that if you're going to develop something really innovative and try to market it as, being safer than what the alternatives are, you have to be able to prove that, and you have to be able to validate that with data. So I think thinking about upfront, what are we trying to achieve and how we will measure it from a scientific perspective is absolutely critical, just absolutely critical. And then the second thing, I'm going to sound like a broken record here with everybody else. It just comes down to behavior. We have to get people to be willing to adopt and be willing to wear it. And, that we can approach that issue from a million different ways. But fundamentally, no matter how great of a mask we design, we have to get people to want to wear it. And, my boss, Justin, had something interesting, and I chuckle about it whenever I think about it. But he said, we have to make wearing a mask like putting on your underwear in the morning. We just have to make it normal. We have to normalize it. We have to increase adoption. And that comes down to behavior. That comes down to messaging. It's a much larger, complex issue than just simply redesigning a mask. But, with that, you can address those issues by thinking about your end user up front, and you can address some of the other issues by thinking about the science and being data informed.
Exactly. Yep. Changing human behavior sometimes is a uphill battle. Elissa, do you have anything you want to add to kind of challenges or things to consider with a redesign?
I think it was covered.
Yeah.
I'm just thinking of like, the elderly and just how important, I think that education is needed. Talk about behavior, people are not used to wearing these masks. It's hard as is, but someone, who's older, that, may have a more difficult time putting it on and off or not, wanting to make it such a habit when, it's so critical for the elderly. So I think just the educating the elderly and the home care workers or home aides that work with the elderly.
Definitely. So we have a few minutes left, and I wanted to kind of bring in the audience, and we've gotten some great conversations going on in the chat. I was thinking about doing kind of brainstorming of people talking about challenges or things that they don't like about their current mask. And I'm sure that we hit on facial hair, and that came up, that was definitely agreed upon. Is there, and people, instead of doing brainstorming, we can just kind of verbally do it. Like, you can put yourself off of mute and throw it and talk about it, or you can put it in the chat. But for me, since I have to wear glasses now when I'm looking at a computer because I'm an old person, when I'm wearing a mask and I have the glasses on, they fog up. So I've been trying to figure out how to make it, how to have a good combination that I don't fog up my glasses when I'm wearing them, or that they have to sit weird because of the bands behind my ears for the glasses. So anything else?
I second that. I wear glasses when I'm driving or walking, and yeah, I can't see, the glasses get fogged up. So yeah, there has to be a better solution for that. Sorry, Katrina, you were going to say something?
Well, I have all sorts of ideas how to make mask more than just a mask. Personally, I found that material is really important. Like when I have a linen mask, and it works beautifully with my face, but other masks, other materials sometimes gives me irritation and whatnot. But on a side of improvement, I think mask gives us amazing opportunity. It becomes another wearable, and with that wearable, we can move it into more of a science and a medical tool, because there are now innovation where you can analyze the breath for any kind of infectious diseases, and putting a sensor in a mask opens up completely different opportunities for early diagnostics And I think that is an untapped territory that obviously would be interesting to look for. And then it becomes just another, you have your Apple Watch, you have your special mask that just monitors you for health.
Yeah, that's a great idea. And it does. There's a lot of things that it could measure with with your airflow.
Yeah. But also I was joking with Lynette earlier, we all know facial masks. So why not have a hydration insert into your mask to do a facial on the go? I don't know.
The other day I saw someone was talking about things they saved money on because of wearing a mask, and it was breath mints, because they're like, I don't have to pop in a breath mint before a meeting because I have a mask on. And but on the flip side, I've also had eaten, garlicky stuff at lunch and then put on a mask and was like, oh my gosh, like I can't even stand my own smell right now. So like for me, like I put essential oils on felt balls in my dryer. So like I've been using different scents for that, which lingers on it longer, and I'm not breathing in bad chemicals. But any other things that drive you nuts about your mask that you think?
I realized I should have invited my grandmother to this session because she actually sewed these masks for me. And she's genius because it includes this strap on the back. So instead of it going around your ears, it just wraps around like your whole head. And it's very comfortable. And I feel like it alleviates the glasses problem too, because when you have it wrapped around your ears and then you put your glasses on top of that, it's just like all this irritation on your ears. So I love that. It doesn't solve the fogging up problem. That's my biggest pain point for sure, to the point where I just say, all right, I'm not going to wear glasses if I'm going outside. So not good.
So if I may, with the glasses fogging issue, my name is Hala. I am a maker and also a co-founder of a tech company. And I have a very forbearing partner who has tested a lot of mask prototypes this year. He wears glasses. He read somewhere and has tried this, that folding up a facial tissue, Kleenex, and putting it under works well for blocking fog. It does. But if you want to take a sip of water or do something and move your mask, you're going through that whole process again. So I'm working on a prototype right now, a rolled up like soft jersey, something that will act kind of like foam without putting foam on your face for hours at a time, which will also disintegrate with repeated washings and the application of heat, but something to act as sort of an air barrier in the same way.
Mm-hmm. So. I'll have to try that out. And that kind of brought up another point. People have talked about having like holes in there to put like a straw. So like Kamiko, from a design purpose, like scientific, like that to me is, if you create a hole to put a straw in, then that's just another hole that things could come in or go out, correct?
I mean, I could certainly see that being a risk, but like with anything, you have to have the data to back it up, and you have to find ways to test it depending on what the design is, and that's always the $1 million question. Can I follow up on a little bit of this discussion that I'm hearing? Mm-hmm. So, as we are talking about facial hair, what emerged to me with the design of masks is the importance of cultural competence. And I think that's really important, especially with a lot of the conversations occurring now. In some cultures, having facial hair or a beard is just, it's what you do. It's part of their culture. So how do we create masks that are inclusive to people of all different backgrounds and cultures and everything? And, that's an interesting question, because it's always that trade-off. And, we've seen with a lot of other public health crises that sometimes addressing cultural norms is your biggest barrier to eliminating an outbreak. We've seen it with Ebola, and how do you take those things into consideration? Mm-hmm. And I think that's where the human factors and understanding who your end user is comes into play. but it's just knowing your audience. And, you know, I think that's a really interesting opportunity that exists for mask designers now, is how do we take into account all of these cultural norms that people have and make them safer too? How do we be inclusive?
Yeah. So a couple more things in the chat. There are 1-inch bands that you put on your mask loop to take pressure off your ears. For girls, there's a plastic cup with holes that you put on your mouth area that keeps your lipstick from getting on the backside of your mask, which I know, not to call out Tracy, but we've talked about this before. If you put the glasses on over the mask and hang it down a bit below the top of the mask, it really helps with fogging. And then someone said, you fit test the mask and then put on the mask. So any other crazy ideas that you'd like to see with masks besides Karina's facial on the go? Anything else that people have thought about creatively? Like, I was thinking for helping kids wear them, it should be like washable material. Like, they could take markers and draw on it, and then when they put it in the laundry, it's like a blank sheet of paper again, and they can draw on it. And for my therapist friends out there, the kids could, you know, put smiley faces on their mask on how they're feeling that day when they're in therapy appointments. But something fun for the kids to like own and be creative. I think some of the drawers out there would love that. So any other ideas? Yeah, Justin.
Yeah, so great conversation, guys. I love it. I think that, you know, another thing that we here at BARDA, you know, that we're thinking about is innovation around, the $1 million question is always fit, right? I mean, Adrian, who's on the team, who's listening in, is one of our experts on respirators. And, you know, we've been developing and designing an N95, like, you know, since, you know, 2009, right? We saw that there was a gap here, and we've done a lot of work both on, can we make it reusable? Can we make it you know, most one size fits most, right? It won't be one size fits all because it just won't happen. But can we make it a 3-size mask, right? Can we make it, you know, the manufacturing process automated and competitive to overseas masks that come in? You know, those are all things that we've been thinking about. One thing that we haven't thought about on the scale and being prepared, right, for this pandemic is that I've seen is from a public health standpoint of exactly what people are saying, like, how do we try on masks? Because you're just buying masks and then you're like, I don't like this mask because whatever reason, it fogs my glasses, the nose bridge is just not tight enough, or it's too small, it's too big, whatever, it's uncomfortable on the ears. Like, I think we should, like, part of this idea that Kumiko and the team are charged with is trying to identify like the barriers of, like, how can we reduce these barriers? Can we standardize the sizing, right, of all commercial masks? Like, you know, most people, when you buy your size, I mean, for men, it's easier because they're like, okay, I'm a medium, I just buy medium nonstop. Obviously, there's a little differences, you know, amongst different fashion designers or wherever you're getting your clothes from. But can we kind of sort of move towards a standardization process for commercial masks, not just N95s? And an idea, Kumiko, that just came to me that we should write down is like National Mask Measuring Day, like where we have CDC or something just offer, hey, we'll take your measurements and say, this is the mask you need to buy. Like, you know, A1, you know, X, you know, is this size or something like that. We should rally around that kind of thing.
It's also the shape of your face that I think will determine that. But, you know, for the future conversations, and I know we're going to have a whole bunch of those in the coming weeks, I think we need to invite an anthropologist, because I'm just thinking it's such a big part of the human behavior to recognize the face and the facial expressions and how you behave around it. And we need to talk about it. If you cover most of your face, what does it mean for your social skills?
Right.
And yeah, exactly.
Well, so, you know, I don't know if Kumiko, you mentioned this, but, you know, it's when the United States culturally, pre-pandemic is if you're on a local transit here in DC, is Metro, wherever you are, if you saw someone with a mask on, you'd be like, oh, get the hell away from, get away from this person because they have some kind of disease,
Germs,
right? But if you go to like Asia, what they learned from in 2005, from SARS, is that like everyone wears masks, and if you were on public transit, you didn't have a mask on, they would be like, "What are you doing? Like, there's something wrong with you, right?" So, what you mentioned is one of the biggest barriers back in 2009 when we were like trying to push masks real hard for H1N1 was the United States form of communication is seeing the mouth, right? And if you like cover your mouth or if you don't make eye contact, there's it's cultural norms that are preventing this communication dialogue, and will that change post pandemic? I foresee it will, but will it last? Don't know. Not in the United States. I don't know.
Can I jump in for a second?
Yeah, please.
I think we're all sort of talking around the elephant in the room. Not to mix my metaphors, but certain political parties are known by that animal. It's been said that if you want to understand the behavior of an individual, you just have to look at their compensation plan. What are they incented economically to do, and in this case, what are they incented economically to believe or not to believe? I don't believe that half of the American public is stupid or unscientific or irrational. I believe that they are suffering not just the inconvenience, but in many cases, the tremendous economic pain caused by the coronavirus, and that because certain leaders give them the reason to believe that the COVID doesn't exist, and that if you wear a mask, that in fact it's dangerous or counterproductive. It allows them to then rationalize doing what they really want to do, which is to get on with their lives so they can get on with earning a living. I'm praying for what's going to happen with this election, that if hopefully if there's some changes, and I don't mean to be so overtly political, but if there's some changes from the top, we may be able to begin the process of re-education, and also helping people understand that it really doesn't have to be either or, that it's a false dichotomy, which was really created because one political party needed to distinguish themselves from the other, just as they decided that, that Obamacare was a bad idea because it was Obama's idea. Anyway, but I think that that's something we need to really think hard about. I spent some time over the last few weeks up in New Hampshire where they don't require mask wearing, and where there are large areas within the state where people proudly don't wear masks, and you suffer a lot of abuse if you do. So there's a lot of healing that has to take place if we're going to change behaviors and save lives.
Yeah, yep, there is. This was stated the other day that it seems like the pandemic has now become a political statement, and unfortunately, it's about health and safety. And I think some of the stuff we talked about with education tonight, and trying to figure out like how do you change the human behavior, and if someone doesn't want to wear a mask, that's fine, but don't make fun of or say things to other people because they are, we should be kind to everybody and be nice and do what's right, kind of thing. I appreciate our panelists tonight. Thank you so much for your time and conversation. This was great. We will be doing more mask redesign conversations coming up. So kind of check out the Venture Cafe newsletter every week when we'll be announcing different things coming up, because there'll be some great stuff. So thank you, everybody. And keep those ideas in mind, because there could be some cool stuff coming up.
Thank you.
Thank you, Lynette.
Thank you,
Bye.
everyone.
Thank you, everybody.
Bye, Kamiko. Bye, Fang.
Bye.
Bye, Gary.